Welcome back to the conversation. I'm Mark Thompson. A pleasure to welcome in Dr. Chakraborty. She is someone who is really just what the doctor ordered, if I can use the expression, a risk and behavioral scientist. And we'll get into a little bit of risk assessment and also the science of human behavior as it relates to COVID-19, to the coronavirus and this latest iteration of the coronavirus that we're all dealing with. Hello, doctor.
Hello, thank you for having me.
These days, I feel just calmer with a doctor anywhere near me, even if it's virtually, as is the case now. What is risk assessment and risk management? Explain that to us.
So it's really understanding the big picture of a risk. We can't look at risk in silos. We are so interconnected. We're globalized as a global society, and our transportation system is so fast that whether we're talking about climate change impacts, infectious disease, food security issues, transmission of different diseases that are stemming from other parts of the world, and maybe not even coronavirus, but those that are used, mosquito vectors, for example, that are taking diseases that are endemic normally to the lower latitudes or the tropics that are now we're seeing in other places like Zika. This is needing to look at the big picture, and that's what risk assessment and risk management does. We don't study risk in silos. We look at how these different risks are related to one another and how decisions about a risk result in unintended consequences sometimes. And then what does that big picture look like?
So when we talk about the risk in relation to this COVID-19 outbreak, for example, apply then the risk management and the behavioral science to that situation.
Right. I'm so glad you're asking me that, because we really need to get a grip on this and put it in context of history and in the context of the bigger picture. We've had infectious disease outbreaks for as long as we can remember. It's something that happens on occasion, and when it happens, leading up to it, most people are complacent because if it's not in your face, despite every healthcare official or scientist promising that this is not a when, but not an if, but when situation. We know that infectious disease is going to break out. We have field epidemiologists on the ground who are surveying hotspots around the world all the time. So that should make Americans feel much better and safer in terms of there is a system in place behind the scenes that we're not hearing about all the time. So it's not always in our face, which leads to complacency. But then inevitably, when an outbreak does, rear its ugly head, then you have this panic that emerges. And that is by a playbook, and it is almost every single box that you would expect to see checked in terms of complacency, then panic related to a disease outbreak is what's happening here with COVID-19. We've seen it in the past with Ebola, with SARS, with MERS. Pick your infectious disease. We are by the playbook in terms of how we are processing this risk and how we're reacting to it.
And so what we've seen is these worst case scenarios drawn out, and then we've seen sort of even best case scenarios that still sound like worst case scenarios, and then behavioral, I guess just human behavior kicks in, and behavioral activities that are, quote, normal in relation to that news, they lead us to buy everything off the shelves, to hoard, to hunker down. I mean, we all become doomsday preppers.
Right, exactly. And it's really disappointing that we haven't learned over all these previous outbreaks exactly how to proportionately react to the reality of the risk. Ultimately, what we study as a risk community is the base rate statistics of impact to human overall well-being. And that's not just human health, but also social impacts, economic impacts. We don't live in silos, and we live in relation to one another. The decisions and choices we make as individuals impact those around us, mainly our close contacts when it comes to the health component of an infectious disease outbreak, but very much our communities and our states, and it goes up the chain from there. We're a global community. So we really need to remember that our behaviors have ripple effects, and they are not isolated to just us. And what is so imperative to remember when something like this breaks out is how much of our reaction is based on the virus itself, or is it based on the panic? and it's based on other people's reactions to it. Remember, nothing about this virus has changed. From the moment we learned about it, from the moment we first heard about its mortality rates, its transmission rates, if anything, the news has gotten better about that because we're learning more. And as we're learning more, as a global public health infrastructure system, we're able to address it, move in real time, and move faster and better than we ever have in human history in our ability to work together, to sequence the genome, to move quickly to get the vaccines out there, which will still take, at least a year. But the point is that we are better prepared and we have better governance than we ever have had. So
well, I would just challenge maybe the last part of what you said, because I think one of the reasons that people are panicking, and maybe, I don't know, probably they misunderstand a lot of what you've just laid out, because we only get bits and pieces. And I do want to challenge you on another thing that you just laid out. But right now, let's just talk about the governance. It does appear as though we were late to the party with isolating populations that were displaying even symptoms of this. We were late to the party with vaccines, with the systems, the pandemic strategists who were there at the White House, as you know. I mean, I don't mean to make it a political thing, but the fact is they were let go because they were Obama holdovers. So it felt as though a little bit of the infrastructure concerning pandemic might have been lacking, and maybe that leads to panic on down the way.
Oh, 100%. We were not prepared for this. We weren't as prepared as we could have been or should have been. And this is another example of when nothing is happening, the public healthcare experts and system are always insisting for more resources. And there's a reason for that, because we know inevitably these diseases are gonna come out. This one is relatively mild. We'll look back on it, and compared to disease outbreaks in the past, it's bad, but compared to what it could have been, it's gonna come across as mild, right? But there is the potential for a serious outbreak that is both lethal and transmits as quickly as we're seeing COVID-19 transmit. For that reason, if we aren't proactive and prepared leading up to that disease from emerging into society, then we are going to be in a situation like what we're seeing now. This is almost a dress rehearsal for it, and we're not doing a great job. But the point I was trying to make was that we are still better prepared than we've ever been in history. But are we prepared for a future really lethal outbreak? Not even close, and that's what we're learning. So the benefit and what we're gonna gather from this COVID-19 outbreak is where the gaps were, where the weaknesses were, because we really need to figure out exactly what we need to do at the local levels all the way to the global level to accommodate when a real seriously lethal disease breaks out. And we need to be proactive about it. And that's why we have this system in place that is trying to actually prevent a disease from ever emerging. Imagine there's 1.67 million diseases out there that haven't emerged yet because we are so proactive. But again, because you're not hearing about it, it's only when a disease like COVID-19 makes it to human transmission that you have this mass hysteria and this feeling that we are not protected. Ultimately, we are better protected, but we need to be prepared for something far worse in the future.
Wow, so well said. I was feeling better until you got to that 1.6 million diseases part that still haven't, and then I started to feel worse. Tell me about the first thing you said. You said, we've been through these things before, and I'm thinking, well, yes and no, right? We've been through MERS and SARS and Ebola, you mentioned, but Ebola didn't really affect the communities at large the way we're seeing the widespread infection of communities in this country with this.
Right. No, and that's completely fair. We cannot really compare this in that sense. There were unique differences between these various infectious disease outbreaks, but the reality of the risk versus the perception was very much the same. So we allow new things, unfamiliar things that we don't have information about yet, things that impact vulnerable populations. Children usually are any risk that impacts children and the elderly, we prescribe much more risk to, and we overestimate its probability and frequency. We saw that with Ebola. Again, it was the playbook of risk perception. When you check off all these boxes of what brings us fear, then you can predict that people are going to have a non-calibrated reaction, which means we will systematically overreact to something like an Ebola, to something like a SARS, to something like this COVID-19. And unfortunately, the reverse is true too. We systematically underreact to a climate change event. And because we don't perceive that same immediate impact, that same impact to the elderly, that same impact to the children. So it is something that we have seen is really true across any major global risk that has emerged. How do we better calibrate ourselves and our governance so that we are reacting to a way that is proportional to the risk that is posed to the globe? Because we have limited resources. So ultimately, if we aren't really prepared for disease outbreaks like a disease X in the future, then we're doing ourselves a massive disservice. But if we are over allocating resources to diseases or to other risks that don't deserve that amount of time, attention, and also causing unintended consequences and ripple effects, which I am really fearful might be the case with COVID-19, then we lose as a whole. We do not have endless resources here, and we need to be better aligned to the reality of the risks that we're facing.
You know, we're running out of time. I love what you just said, but then you took it to COVID-19, and I'm wondering, really, I mean, if a couple of million people die from this, I mean, and maybe that's the low number, isn't that worthy? And we only have a few seconds left, but I wonder, isn't that worthy of considerable assets going towards something like that as a threat?
So there's no universal answer to that, right? Because risk tolerance and tolerance for exposure varies across cultures, across different ethics, morals, countries, geographic locations. There's so many different views on what is an acceptable amount of exposure and risk for a certain community. We don't have a universal recommendation for social distancing, for containment, for quarantines. We're seeing that in the United States, where you have different communities reacting in different ways. I would argue that this has to be based on the community transmission. How do you define a community, and what is the transmission? Because if it's intense, then yes, you should be putting in the appropriate amount of resources to negate that. But if there is not a sign necessarily of an outbreak or symptoms, then to overreact and to put in too many resources, there are unintended consequences from that overall might increase the risk of that community. That's what we need to be careful of.
Fascinating conversation. I'd love to continue at another time. Dr. Sweta Chakraborty, you know, your podcast, you still do the podcast?
Yes, risky behavior.
Yeah.
The radio station is closed because out of abundance over caution.
Oh, of course.
But yes, normally every Friday live.
But that's really great. And you have a book coming out too, I think. Don't you? Securing Our Future, How to Thrive on a Rapidly Changing Planet?
Yes, the title is shifting slightly. It's actually talking about overreactions to risk, but I cannot wait to share that with you. Thank you.
Well, we'll have you back then. It was a pleasure to meet you, and thank you.
You as well, thank you.
Be well.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.